We're excited to be on site at the University Hospital's broadcast studio with our first segment for today. We're thrilled that UH has joined Golden Opportunities to share important health information every week, which means we'll be visiting the studio a lot. Today, Dr. F.A.C.E joins us to answer the question, what happens if I have a stroke? Dr. F.A.C.E is the director of the Comprehensive Stroke Center and Neurological Institute at University Hospitals. Welcome to the very first show with UH. I'm really excited.
Thank you very much. I'm glad to be here.
So how can we tell if we're having a stroke?
Well, most of the time you can tell. It's a classically weakness on one side of the body or numbness on one side of the body, difficulty speaking like slurred speech or losing the vision in one eye. But about 20% of the time, people may not have insight into their symptoms. They may have some sort of impairment of their awareness. And then it's really important for a coworker or a spouse or somebody who's a friend to recognize that something's going wrong.
Right, and right away do something about it. Any other symptoms that aren't so obvious, maybe?
Troubles with walking, like stumbling, a catch in the leg, difficulty seeing to one side, a confusion or lightheaded feeling, or a very severe, sudden, uncharacteristic headache, even in someone who's typically a headache sufferer.
Okay, so if you see anything going on, sense there's something wrong, call 911, correct?
That's what we tell people to do because every minute is important. You could lose up to 2 million brain cells a minute in the setting of a stroke. And so it's very important that you get to medical care right away.
Okay, so if we've already made the call to 911 and we're waiting now, what do we do until they get there?
I think the best advice is just to keep the person calm and comfortable. Get them down in a comfortable position. About 85% of strokes are blocked artery strokes, which means blood can't get to the brain. And so having them down with their head down is probably the best thing to do to get blood to flow up into the brain.
Okay.
But if they're having troubles with their saliva or swallowing, sometimes having their head propped up a little bit or turned to one side, and speak soothingly and calm. It can control their anxiety because when you're very anxious and your blood pressure spikes up, that could do some harm.
Okay, so once the emergency squad gets there, what happens next?
So the next thing is that the squad goes through protocols. They go through an assessment. They confirm whether they think this is a suspected stroke, and they get on the horn right away to let the hospital know that they have a potential stroke victim coming in. And then they very quickly get in the vehicle, lights and sirens, make it to the hospital. So the hospital now has pre-notification that somebody's coming in, so the staff are ready to receive the patient, to clear the CAT scanner, to get that brain imaging done, because that's the most important test to figure out whether this is a bleeding kind of a stroke or a blocked artery kind of a stroke.
So there's different treatments for different types.
Oh, very much so. So I mentioned before that about 85% of strokes are blocked artery strokes, and we have this important treatment, the TPA or clot buster medication. And this medicine needs to be given as soon as possible, but through most protocols within 4.5 hours of the onset of stroke symptoms.
Wow, so you really got to move fast there.
You sure do.
So what happens if we get there and nothing's going on? Everything's okay, actually?
Then we are thrilled. So about 80% of these very transient events are actually TIAs, and they're not associated with any brain damage. That's very important because it's a warning that something was going wrong, and we better figure out why the person had an almost stroke to prevent them from having a real one happen.
All right, this has been great information. With a stroke, early treatment is vital for the best recovery. So follow Dr. F.A.C.E's advice and call for medical help at the first sign that something doesn't seem right. My thanks to Dr. F.A.C.E for joining us today for the first of many segments from the University Hospital Broadcast Center.
For more information, call University Hospitals at 1-866-UH4CARE or log on to www.uhhospitals.org.